Good morning, good afternoon, good evening, everyone. Welcome to the first ever 9-in-3 annual conference and this training workshop for early career researchers. My name is Esther Nanfuka Kalule. I work as the research fellow of the 9-in-3 project based here at Makerere University in Kampala, Uganda. I have held this position since 2017 when the project commenced. So as the title indicates, my presentation focusing on researching traumatized populations. I draw on our experiences of researching traumatized populations here in Uganda during the 9-in-3 project to provide insights into possible strategies for ensuring not only successful data collection, but also the safety of both participants and researchers, which is an ethical issue. So I'm aware that my suggestions may not work in all contexts, but hopefully you will be able to draw some lessons that can guide your research among traumatized populations in your own context. So in terms of the outline, so the presentation focuses on two main themes. First of all, it provides an overview of the research carried out during the 9-in-3 project and highlights the traumatized populations that were involved in our studies here in Uganda. And then it provides the key considerations and strategies that can be used to conduct the research successfully and ethically. So I'll go straight to providing an overview of the research. So during the project, we conducted both qualitative and quantitative studies. And here in Uganda, both studies were conducted in the central and northern regions of the country. So I'll start by describing the qualitative study we conducted here in Uganda. So the study was entitled Issues, Beliefs, and Experiences of Child Marriage and Gender-Based Violence in Uganda. And we conducted it between July and August 2018. So the qualitative study had 4 specific objectives. The first was to explore the social and cultural predictors stroke drivers of child marriage among girls at individual, household, and community level. The second was to explore the consequences of child marriage for both the victims and Ugandan society. Then to investigate the conceptualizations, prevalence, predominant forms, and causes of GBV in Uganda. And lastly, to extract lessons that can be used to develop ecologically sound anti-GBV video games aimed at changing cultural, social, religious, and other attitudes towards GBV and child marriage in Uganda. So on this last specific objective, we are happy to report that we have been able to develop a computer pro-social video game to empower children and young people in Uganda to address child marriage. And we shall report on this later on in the conference. Maybe what should be noted is that this game was informed by the findings of this qualitative research. So who were the study participants for our qualitative study? So we had 45 women survivors of child marriage, and 12 of these were formerly abducted girls. So they were women by the time we interviewed them, aged 18 and above, but they had been abducted and forced into marriage as girls by a rebel group called the Lord's Resistance Army, which wreaked havoc in the northern region of Uganda for over 20 years, although the war has since ended. Okay, so we also interviewed men 25 and above exposed to violence but were not violent. Then male youth 16 to 24 exposed to violence but were not violent. Then male youth 16 to 24 who had completed or at least halfway through a violence reduction program. And then male and female community members, and these were selected from the specific villages where we got the rest of the participants. Now, for the quantitative study, so we conducted a psychosocial survey with children and young people to learn about their experience of violence and how it had impacted them, and particularly on their mental health outcomes. So this study was conducted shortly after we had concluded the qualitative study between October and December 2018. So the survey involved children and young people in 72 schools. We targeted both primary and secondary schools, and all these schools were within the central and northern regions of Uganda. So like the qualitative study, the quantitative study or the psychosocial survey also had 4 specific objectives. So the first was to examine the prevalence of childhood maltreatment, both within and outside the home, across genders, regions, and districts. Then to assess the prevalence of exposure to violence within the home, across genders, regions, and districts. Then to investigate the prevalence of underage marriage across genders, regions, and districts. And to examine mental health outcomes across genders, regions, and districts. So the study participants, as already indicated, these were in-school children and young people aged 10 to 17 years. And like I've already indicated, they were drawn from 72 schools, which were both primary and secondary. So in general, we had 4 traumatized populations in both studies. So the first were child marriage survivors, and in general, and then formerly abducted women who are also child marriage survivors, but a unique category because they had been, forced into marriage while in captivity. And then we had GBV survivors in the community, and then abused children and young people who participated in the psychosocial survey. And these had been subjected to various forms of abuse, including physical, emotional, sexual, and even neglect. So how did we go about ensuring that we successfully researched these traumatized populations? So I'm going to present a number of strategies that can be used to ensure successful research among the traumatized populations, such as the 4 that I have identified. So from our experience, one aspect is deliberately including some research assistants with professional counseling skills on the team. In our case, these were very helpful during the psychosocial survey. So some of the children that were being interviewed or that were participating in the survey got traumatized by the questions being asked. So it is these individuals that helped to provide them the immediate psychosocial care and support that was needed to calm them down before we left the schools, and in some of the cases, referred them to our partners for further help. So it would have been extremely difficult for us if we did not have these individuals on our teams, considering that in most of the schools in Uganda, there are no social workers or even what you may call professional counselors. So this is normally done by teachers called senior women and senior men, but they do not really have the competence to provide professional counseling in complicated cases, such as the ones that we faced. Then secondly, you can establish a psychosocial care team for the study well in advance before you go to the field. And in our case, this was a team of professionals willing and ready to support both participants and researchers in need of psychosocial support during the study. So I'm including researchers, as I'll explain shortly. So in our case, creating the psychosocial team, psychosocial care team was a requirement of the IRB, but it was very helpful, as I'll explain shortly. Then thirdly, it's important to engage and forge partnerships with local authorities or service providers who can be called on to respond in situations of critical need or high risk. So these have to be mapped out and engaged in advance, and you can even formalize the partnerships through MOUs or Memoranda of Understanding. So in our case, formalization helped to strengthen the collaborations and eased access to support by the study participants. We referred to the respective partners. So because we had arrangements that were formalized, it was easy for our participants to get help, and they were prioritized whenever we referred them there. Then, and in our case, our key partners were the case management team from the Uganda Child Helpline 116, which is hosted in the Uganda Ministry of Gender, Labour and Social Development. So while this is at national level, they could easily link up with district structures where we conducted the study to alert them about the need for help for some of our participants, because there's that coordination and network. And then we also partnered with a national NGO called Action Aid Uganda, which runs several GBV shelters and provides care and support to survivors of GBV in several districts within the country. And they had presence in all the districts that we went to. So it became easier for us to refer our participants who needed support there. And these partners were also helpful, especially Action Aid, in identifying GBV survivors, particularly survivors of child marriage, for us to engage. Then it's also important to thoroughly train the research team to equip them with skills to appropriately handle incidents of distress and potential risk to participants during interviews. So as you train the research team, these are some of the key things to emphasize. First of all, giving the participants who break down a moment to recover before continuing the interview. It's very important for them to know that when someone breaks down, give them some time, give them some space for them to recover, and then afterwards you can ask if they can continue, and then you continue the interview. And then we also emphasize that it's important for the interviewer to move at the pace and intensity of the participant. So this can help to minimize intrusion and also minimizing, evoking distress and trauma. Thirdly, we also talked about, the possibilities and importance of terminating or changing the topic of discussion in case an interview is interrupted by a perpetrator, such as a spouse. So while we did not create guides on this, for you can actually, think about developing a short diversionary guide on less sensitive topics, such as children's education. And, and maybe we can even talk about things like the weather in our context here. We can even talk about, maybe farming, because most people here are farmers, or how life is generally. Of course, right now there's even things like COVID. So those would be less intrusive topics or less sensitive topics to talk about if somebody has interrupted the interview and you fear that they could actually abuse the participant after you've left. Okay, and then it's also important to emphasize the referral and linkage procedures so that the team can be able to refer and link participants to care or to support services in case they discover or identify incidents or risks of abuse to the participants, during the research process. Then another strategy that became, an issue for us was scheduling interviews in a manner that allows enough time between, the different appointments, because we found that we had to sometimes spend more time counseling participants who had been, traumatized or who are affected in one way or the other by our interviews or our research process. So if we had scheduled the interviews very close to each other, it would have been difficult for us to transit from one interview to another. So in the schools, most of the times we scheduled the interviews, for morning and then afternoon and then sometimes evening. So this helped us when we got incidents of trauma among the children. We could actually sit with them, counsel them, and then even organize extra support and help from our partners before we left to the other school, and this did not interfere with our schedules. So then for the qualitative study, most of the times we scheduled only 2 interviews, because in case we had to respond, it normally took a lot of time. So morning and evening, then we had enough time to organize for support if it was necessary without interrupting our schedule. So next we move on to the data collection phase. Now, it's important to be mindful of possible secondary trauma to the research team. So it's not only participants that may get traumatized, by the horrible experiences that they've gone through. Okay, so the research team can actually also get secondary trauma. So you have to inbuild measures to provide support in case this happens. So, for instance, in here during the psychosocial survey, some members of our research team got affected by the horrendous stories that the children were sharing. Okay, so I remember I was in a school where one of the research assistants broke down while we were having a session with traumatized children. And she was so shaken to the extent that she could not even proceed with us to the next school. We had to first, link her to support and even give her some time off to recover before returning to work with us in the field. So what are some of the strategies that can be used to provide support to the research team? So the first could be holding daily briefing sessions, or at least regular, even if it's not possible to do it daily, maybe regularly every other day, to talk about their experiences and to provide them the necessary counsel and encouragement and support. And of course, through this, you may also discover that they may need to talk to maybe a social worker or a counselor, and then you link them for support. Then in case there are any severe cases of trauma, you can actually call on the psychosocial care team for further help. So this is where our psychosocial care team that we had established at the beginning of the study became very helpful in not only supporting our participants but also members of the research team. And then from our experience also, we found that it's important to be flexible, to allow those who are badly affected time off to recover. And this is especially practical in studies that take a long period. For like in our case, it was, we were spending weeks, conducting these studies. So it was possible to allow people a day or 2 off until they felt like they could continue, and then they returned to the field. Then secondly, for girls and women experiencing violence, the mere act of participating in a study may provoke further abuse. So it's important that as you plan and as you conduct the studies, you prioritize both participant and researcher safety. And these are some of the strategies that can be helpful in this regard. First of all, you can allow participants to reschedule or relocate the interviews to a time or place that may be more safe or convenient for them, especially where the interviews are conducted in the community. So maybe, of course, for the schools, it was a bit difficult, but for the women, and the rest of the participants, it was possible. Then 2, you can encourage researchers to conduct interviews in public spaces, for example, outside the house, because here it's easier to escape in case maybe you're being threatened by maybe a perpetrator or somebody who is not happy that you're engaging a woman in an interview, or a child, even a child. And then also providing participants detailed information on where to seek support. And we found that it's always important for you to do a mapping way before you go to the field, so that you identify services that are near, to the participants that you're going to interview. Because like in our case, we knew that we were going to specific districts, so we mapped out and identified specific service providers and got their contacts, so that it would be easy for our participants to get support. So, and in our context, we provided this information in the form of information sheet, through information sheets and debriefing forms. So this is an excerpt from the information sheet we used in the psychosocial survey. So these were children. So this is just a statement where we provided the information for them to seek support when they needed it. So it reads, answering questions about violence can be very upsetting. If you would like to receive guidance and counseling, please contact the social worker on the team. So we always introduce the social workers on the team whenever we got into schools. Before the children started the survey, they would always see who the social worker was. But also, of course, like we shall see in the debriefing form, we would also ask them to talk to the researcher if they needed some support. So if you wish to speak to a counselor in future, you could contact Esther Nanfuka, the research fellow, and then we provided the telephone numbers to allocate you one. And then we also informed them that they could talk to the researcher who is giving out the questionnaire. So we provided the same information in the debriefing form after conducting the psychosocial survey. In this case, we were saying if answering this survey was upsetting, please know there is help available to you. If you would like to receive guidance and counseling, please contact the social worker on the team. If you wish to speak to a counselor in the future, you could contact Esther Nanfuka, the research fellow, and then we provided those specific telephone numbers. So that is what I had for you. Thank you for listening. Any questions are welcome. Have a great day.